Thank you, Madam Chair and Ranking Member for having this meeting. There is an urgency on the ground in getting vaccine doses out. Over the past several weeks, I have heard consistently from Arizona public health officials that we need more vaccine. You know, back in the summer, I asked Dr. Fauci and the head of the CDC and the logistics head, are we going to be ready in the fall and the winter? They said, we hope so. In September, I asked Dr. Fauci, are we going to be ready soon? I hope so. We are still hoping because of the lack of a coherent national plan. However, I've heard testimony today about transparency, data systems, the public education campaigns, none of which are where they need to be at this point in time for this vaccine program to work at all. As of yesterday, only 65% of shots have been used nationally. My home state of Arizona lags behind at just 61%. Notably, these numbers have improved in recent weeks and are trending upwards. I'm trying to understand where the disconnect is here. With such a large demand for shots, we need to understand why more than 1/3 of shots distributed nationally have been unused. And I believe hesitancy from priority individuals needs to be discussed. Just today, it was reported that only 37% of nursing home staff have received their COVID-19 vaccine, in spite of what was going on in West Virginia. But I think that we have solving the second shot issue. I don't know where we're going to be with that. There 6 weeks, 8 weeks, elderly people, non-elderly people who recent developments regarding the variants of COVID-19, including those from South Africa and the United Kingdom, have emphasized the importance of being vaccinated. When it comes to these more easily transmitted strains, using every available dose as soon as possible will help ensure that these variants do not continue to evolve in a way that may cause vaccines to become less effective. However, this will prove problematic if delays in getting the second shots happen. The protection against these variants will be even worse if individuals do not get their second shot of the vaccine within the recommended time or soon afterwards. We have cases of the second shots being delayed up to 6 weeks already. I hope that this does not continue. Many rural communities, which have been talked about, tribal communities and communities of color, often have been hit the hardest by COVID. Tribal communities like Navajo, White Mountain Apache tribe, and others in my district have had some of the highest rates within the United States. Likewise, our healthcare resources in rural and underserved communities have been stretched thin, to say the least. To overcome systematic and long-standing trust issues, the roots of which we have yet to see again during this pandemic, we must work with these communities in an educational process as well as a professional medical process. Dr. Ezeki, you have touched a bit on resources needed to promote confidence in the COVID-19 vaccines. What resources can the federal government provide to help states in overcoming the hesitancy with COVID-19 vaccines? What would you like to see in a national public education campaign?
Thank you, sir, for the points raised and that important question. So these things, as you said, predate COVID, but have been highlighted by COVID. And so one of the things that is pretty fundamental is in the area of health promotion and health education, making sure that even from very young ages, we talk about the importance of vaccines, explain vaccinology, the science of vaccines, relate even to youngsters how they don't know about measles, even chickenpox now, polio. No children are doing double dutch with braces on their legs because polio and so many diseases have been eradicated by vaccines. many people don't understand where we've come from to be able to appreciate the vaccines that they have been able to receive or not receive in some cases. And so starting with that, again, that's a long haul. That's infrastructure building that may not give us the full fruits for this vaccine, for this pandemic, but actually will help us towards the next.
Thank
For
you,
today-
Dr. My time is up. I'm sorry. I just want to point out, we're still hoping, and I hope that we are able to get some of the basics done in a short time. Thank you very much, Jim.
Thank you, General.